iUnderstand.
The female reproductive system is a group of organs responsible for reproduction, that's making babies. They are mainly present in the woman's lower abdomen. In order to understand the disorders and diseases, we should first know the anatomy, that's the structure, and the physiology, that's the function of these organs. We should know what's normal before we know what's abnormal, and I will be discussing some normal aspects of the female reproductive system in this video. In this illustration, the model stands in the standard anatomical position, and the reproductive system is seen here in the lower abdomen. Also, there are two section views of the reproductive system. One is longitudinal or frontal, and here we are looking at the inside of a woman's body from the front side. We can see the uterus or womb, which is similar to a goat's head with two horns. These horns are the fallopian tubes, which transport the egg or the ovum that comes out from the nearby ovaries. Also, there are two ovaries, one on each side, attached to the uterus by bands or ligaments. We can also see the thick uterine wall, which contains muscles all over the interior side, and it's called the endometrium. The endometrium is where the growing baby or the fetus gets implanted, like a small seed, and that's where the placenta starts to form. There's also a side view of the uterus, as if we've cut an orange into two halves and are looking from the side on the inside of it.
وبنبص من الجنب فاحنا بنقول عليه مقطع جانبي بيبين اعضاء تانية زيادة شوية هشرحه لكم هنا على
This side view shows additional organs, and I will explain more on this model. As we can see on the side view of the female pelvis, this is the frontal abdominal wall that consists of skin, fat and muscles, and this is the back side where the buttocks are. Down there are the reproductive organs that we will talk about. Parts 11 and 12 are labia minora and labia majora respectively. Along with the clitoris, number 13, they are rich in nerve endings which are responsible for sexual pleasure. At the vaginal opening, you will find two small glands that you will not normally feel unless they get swollen or inflamed. These are called the Bartholin's glands, which lubricate the vagina by producing secretions called mucus. Around these external organs, you will find hairs that mechanically protect the reproductive system from microbes and harmful elements. That pubic hair also carries the personal smell of the pheromones that make a woman attractive to her partner.
الشعيرات دي مسؤولة عن حماية الجهاز التناسلي من البكتيريا والإصابات السيئة اللي ممكن تدخله وكمان بيحملوا رائحة المرأة المميزة اللي بتخليها جذابة لشريكها.
We see here the vagina, and you will notice that it's going up and leaning slightly backwards, and then the uterus. Right inside the vagina, there's the hymen, which is a membrane and can be sometimes not very easy to locate. It is not easy to break the hymen with the daily activities like sports. And sometimes it doesn't rupture at all until your first vaginal childbirth.
ليس من السهولة أبداً إن غشاء البكارة يتفض. أحياناً قد لا يفتض إلا مع ولادة أول طفل مهبلياً.
Up here we have the cervix of the uterus. Did you notice that the vagina is leaning backwards and then the uterus is resting forwards? Why do we need to know that? A different uterine position can affect the woman's fertility and is an abnormality or a defect that is probably present since birth. Also, during pregnancy, when the uterus is enlarged, you will find that the uterus is pressing on the urinary bladder, and this may cause frequent urination and sometimes bladder infections. The myometrium of the uterus, that's the muscle layer, is the layer of the uterus where the smooth muscle tumors known as fibroids or myomas will originate. These tumors are fairly common, especially in African and Middle Eastern countries. It is important to know that myomas may affect your fertility and the continuation of your pregnancy. Also, myomas or fibroids in non-pregnant women can cause problems. They can cause heavy periods or press against the rectum and cause chronic constipation. That's why if you're a lady and you're complaining from chronic constipation, I'd recommend that you consult your gynecologist to rule out the presence of uterine fibroids. Fallopian tubes and ovaries, not illustrated here though, are also important reproductive organs.
إذا كان الرحم كويس لأنه الأورام اللي فيه بتأثر على حركة الأمعاء عندك. الحاجة الأخيرة في الأعضاء التناسلية هي مش موجودة هنا لكن اللي هي قنوات فالوب وهنا المبيضين.
Here we have the ovary, which contains many eggs called ova, that's the plural of ovum. All these will be discussed in the coming videos related to women's health. Stay with us for more on the subject. I wish you good health. This video contains general information about medical conditions. The content might not be suitable for everyone and should not be treated as such. Always consult your doctor before using medications. The medical information is provided without any warranties or legal obligations to those who might apply them.